So, welcome everyone, and thank you very much for joining. And do feel free to unmute, be on camera. Let's try to recreate the sitting in a room feel again. So, I know you have very busy everyday life. So let's just come back to this space. What we're doing is we're continuing with the health literacy training that we started back in April. And this session is focused on the A in TAP-CV, adapt language, right? So we are going to go through, let me start with the walking through the agenda. So we'll go through our learning goals for today. And I'd also like to preview the learning goals for our workshop time next week. Today is an important foundation for the workshop. We'll do a very quick teeny-weeny TAP-CV refresher. Then talk about why plain language matters. Why are we spending time learning these skills at all? And then we'll preview the tools and resources that we will be using in our workshop next week. So today, bear with me as usual. Today is going to be less interactive because we're trying to get through some material. And then during the workshop next week, we will go into the tools, okay? So any thoughts or questions about this plan? Welcome, Taryn. We just had Taryn join us. Okay, so I will dig in. So our learning goals for today, first we'll understand why using plain language at the 4th to 6th grade reading level matters in healthcare, right? And then we will identify some elements of what plain language looks like for both verbal and written communication. So think about it as having the toolkit for turning and actually adapting the language to make it plain. And then we'll learn about the tools and resources today. So that is just a preview for next week's learning goals. And I wanted to preview this because it's very tight. Next week is when we'll actually use those resources in the workshop. So we'll use word substitution resources to revise some complex phrases. We will use readability checkers and scoring frameworks. So today you will see the tools, but we won't really get to dig into them. So hold off, and then next week we'll use those tools. So any thoughts or questions before we dig in? I will take silence as consent and understanding here.
No questions.
All right, thank you very much, Teresa. So very quickly, TAP-CV, what is that? Just want to remind, thank you, Gary. I see the thumbs up. Remind us what TAP-CV is really. Always think of it as we are applying the Universal Health Literacy Precautions Toolkit, and TAP-CV is just a mnemonic, a way of shrinking down this 216 pages into something that is simple and handy for us to remember. So we did the Teach Back training and workshop back in May. And this month, we're focusing on adapting language. All right. So TAP CV, the A is for adapt language, and that's what we're focusing on today. Actually, that's what this is just a reminder here. A is for adapt language in the TAP CV. And what we are learning about and focusing more this month is what it means and how to actually do it. So let's go into why plain language matters. And I think it's important for us to understand that these are not simply nice to haves. These are very important skills that is critical for healthcare. So looking at the entire population and not just native populations, the US literacy landscape itself is a barrier to health literacy. And this is just saying that any adult that you meet in the US, so this is important not just for populations that we serve. Remember that health literacy is not being able to read and write. It's not simply that. It's actually more being able to find, understand, and use information to make decisions. But it does start from just literacy, right, to begin with. And the stats are quite staggering here. In the US here, over half of the adults that you will meet are not able to read above the sixth grade level. Over half read below the sixth grade level. And this is especially troubling because most health information is written at 10th grade level or above. So you see, I've put in the sources at the bottom of the page here so that if you want, you can read more on these statistics. But even things like instructions on a pill bottle, discharge papers, appointment letters, they are a struggle for over 54% of the population. So written information is not accessible. What about the verbal information? The research shows that verbal information is pretty much forgotten immediately. And what's worse, of what is retained, over half of it is remembered incorrectly. So you see that it's really confounding the challenge, but the result is that just assume that the vast majority of adults that you will interact with are not proficient, which means that they don't have the necessary skills. So it's up to providers, people in the healthcare space to be very mindful to try to make the information more accessible, seeing that this is the literacy landscape that we are in. So any thoughts or surprises around these statistics here? Or is this something that you have become very aware in your line of work? Anyone? So I will say that I mean, I have been in healthcare, but it was surprising to see that the base, because usually this health literacy statistic is the one that I'm aware of, but the basic literacy statistics surprised me. So understanding that that is the overall US literacy landscape, it's even more important to focus on making the language accessible when we are serving AIA and communities, because it's on top of challenges that you understand well, that we have these literacy challenges, right? The first, and these are just some, and I'd really love to hear your thoughts on it, on these. Historical mistrust makes the fact that you speak clearly and not sound like you're trying to confuse someone even more important. It's not optional. People in the community are justifiably wary of systems because their evidence and their experience has been very negative. So if you are speaking and you are speaking in a way that is making them feel like they don't understand or they are being tricked, it's just a recipe for the trust falling by the wayside even further. So respectful, plain language is critical, especially when you're serving the populations that we serve, right? The other challenge is that there's already existing access issues. You don't want to add complex language on top of it. If someone has had to travel very far or had a very difficult journey to even navigate to get to you or to get to speak to a provider, the last thing you want to do is now make it seem like they don't understand you at all, right? So you understand these well, the isolation, the difficulty of getting to the health facilities, and then on top of that, literacy rates are what we've seen for the whole of the states and even probably a little worse. They're already uniquely high access barriers. So when you are adding the fact that they don't understand what you are speaking or saying to them in the moment, those disparities only deepen. I do want to hear your thoughts on this. I know that you speak and okay, I think we don't have some of our clinical folks on the call live, but what does this aspect of the fact that we need to be even more careful within the AIA and communities, how does that resonate with you? in that.
I think that's so key and critical because that's what I think, discovered um, while we were in the session there um, while we were there in person, is that plain language, it does touch on all of these broken centuries of broken promises, forced assimilation, systemic discrimination, um, and how that's still impacting us here today.
Right. Thank you for sharing that, Gary. Paula, were you saying something?
Well, Gary makes a good point. I kind of wanted to springboard from that when you talk about historical mistrust. And I think one of the things that um, kiboshes it or makes it more complex is that it's a continued assimilation or forced assimilation and systemic discrimination. It continues, and it even seems, and this is just my perception of it. It just seems to be even heightened right now during these times. So that's a complex piece, and I don't know how much headway we're making with that, but definitely, trust is an issue. And then when you talk about also the cultural, the many varied cultural or native languages, again, definitely need to be in tune with that. So I was just gonna say that.
Yes, thank you for sharing. Thank you for sharing. Oh, Taryn, please go ahead.
Hi, everyone. Can you hear me?
Yes.
Okay. All right. I had to join on with my phone. I think along with the historical mistrust and the other square that you have there, I think another factor is familiarity. I think over the years, even though we have these points, which are very valid, I think because of the familiarity of IHS over the years, that's where most patients are comfortable still going to. And even if they have insurance and can go outside of IHS, I think, like speaking for some of my family members, they already have outside insurance, but they still choose to go back to IHS because that was where they went to growing up and don't want to go outside of the healthcare system.
Mhm. So let me just hear, you're saying that within the IHS system, there is some amount of this respectful plain language. Basically, there is some trust that has been built.
Yes and no. I think it just really depends on their experience, but I think just because there's that outside factor, like I think especially for those who are living away from home, their nearest choice of healthcare is going to be the nearest IHS system, rather than going to a local hospital or anything like that. Finding an urban health program or finding an IHS where it could be 2 hours away, but they're willing to make that
the journey. Yeah.
drive. Yeah.
Yeah.
I think that's a good point that Taryn makes, Doctor. And I guess just my own personal experiences, the chances were greater when I went to a outside healthcare facility of running into some trauma.
Right.
And
Right.
and at IHS, it was mostly staffed by people I knew. I felt comfortable giving feedback and not being dismissed. So definitely the chances were greater. And when I took my parents also to outside facilities, the chances of running into some trauma was greater.
And I mean, you are taking this training, for instance, so it's clear that the IHS focuses on things like this, right? Which unfortunately may not be, oops, sorry, I didn't mean to shift, may not be as much of a focus outside, right? So all of this is to say that we should feel pretty good that we are focusing on this and actually learning how to make it even better, right? So that was the why. Let's get some tactical tools here. And my goal was to pick a handful. I was trying to go for 5, but it turned out that it had to be 6. I couldn't drop the teach back. If you are being conscious about using plain language and adapting your language, what are the elements that you should look out for or to focus on? And we'll go down this path. It's literally a path. We'll start from the first step, which is the first thing is use common everyday words. We will talk about each of these steps following. Second being echoing the conversation partner's words. And I say conversation partner because it's not necessarily a patient. It could be a community member, anyone that you're speaking to, right? And then using active voice, we'll talk about that. It's we don't need to go back to elementary school grammar here. Active voice is just making clear who's doing what. And then keeping our sentences simple. 4th to 6th grade level, and we'll talk a little bit more about that. Using our tone, our bodies, and visuals, and then using teach back, which we learned about in some depth, even when we're together and also back in May. So for the most of the time, let's say most of the 40 minutes that we have left, we're going to be working through these elements. And right at the end, I will introduce the tools and the resources that we will dig in during the workshop next week. Okay. So please do feel free to jump in and share thoughts and comments as we're going. So looking at the elements, the foundation of plain language is everyday words. Using familiar words, right? We're just talking about the power of familiarity. It makes your message easier to understand, easier to act on. So choosing in your speech or in your writing words that people are more likely to hear in everyday life. Heart doctor instead of cardiologist. And then substituting simpler words. This is actually not very easy to do. I was about to say trivial, and I changed it to easy in my in my mind as we are talking about this very thing. We will do this a little bit in the session, like show you the word substitution lists, which are very helpful. And then we'll also do it in the workshop next week, right? Around using common everyday words, what we're trying to do is avoid communicating like you would with another health professional. You have been in the space, this is your language, your terminology. So if you find that you're using technical terms or medical jargon, it should give you cause for pause, right? Avoid using abbreviations or acronyms. Even the ones that you would think are widely understood may not be. So these 2 things, if you find yourself using jargon abbreviation, pause and see what are the everyday words for it. And this is where some of the resources and the tools will help, okay? So we're going down the path to plain language. The very first thing, remember, use your common everyday words. Any questions on that? Should we plow through? Okay, I'm going to plow through. I can't see you, so I'm just going to assume that you are nodding plowing through. The second step or the second thing in the path is echoing the conversation partner's words. Now, in this is actually a much bigger issue here of even the very language that you speak, right? So echoing the partner's words, mirroring the words they are using. If they are saying blood sugar, you say blood sugar instead of saying glucose. This second one is about actually speaking in the language that they are speaking and using trained interpreters if it's available. You'll notice that I've made this a second one and I didn't highlight it too much because I also understand the resource constraints. I remember when we met in person, Dr. Althea said that for months or for years, her translation line was not working, right? The point is that even when these resources are not available, there are still things we can do. So let me just flip back to the path of the 6. There's still things we can do even when part of the number 2, which is the echoing their words, is not available. Ideally, you would want to be able to use trained interpreters, but sometimes it's not. I understand that. Right. So why do we want to echo the words that the conversation partner is using? It may seem like you're trying to correct or upgrade their language. And when you're communicating, the point is being understood. The point is clarity. The point is connection. So if someone is saying my sugars, there's no benefit really of trying to get them to use glucose, right? And repeating the words that they are using, one, it shows that you are listening. It shows that you are connected to them, you are respectful of whatever it is that they are saying. The other thing around echoing echoing the conversation partner's words is allow for there to be something to echo. If you are dominating the conversation, there isn't anything to echo other than what you are saying. So part of using plain language, surprisingly, is allowing the conversation partner to also speak, right? Okay, so let's move to the third point in the path. The first point was around using everyday words, echoing them, the language. This third point here, active voice, is just around speaking in a way that says exactly who should do what, right? So there's active and passive voice. And trust me, I had to look it up to the definition of active voice and passive voice. I decided not to use those definitions and just say it's speaking in a way that leaves no confusion, right? Take your medicine every day instead of medication should be taken every day. And active voice is just saying who does what and when, right? Passive voice is where it's the actor is unclear or who needs to do what is unclear. So it's saying something like it must be completed. Who must complete what, right? It's like you must do something. That's what changes the sentence from passive to active. And part of plain language is using this active voice. Okay. All right. Then once we've started with common words, we are echoing words that they use, we are using active voice. It's the next skill, and this one is frankly quite hard to do, but the next skill is to try to keep your sentences short. And the guidance is 8 to 12 word sentences. How do you know what you have said is 8 to 12 words? The trick is, if you can say the sentence in one breath, it is probably short enough. If you can't, then you are probably adding too many ideas. So let me go through an example here with you, and I'll ask you to just say some things to yourself in your head, and you'll see what it means to do 8 to 12 words. So call this number to make your appointment before next Friday. That's 11 words. That's getting up there, right? Let me show you an example of a sentence which is probably too long. If you have to pause for air or stack multiple ideas, your sentence is too long, like this one. I realized after I wrote this sentence that, wow, it's very easy to write and say sentences that are too long. The reason we try to keep sentences short and simple, that's what the the 4th to 6th grade reading level calls for, right? So as part of using just short sentences, you also want the readability of the sentences to be 4th to 6th grade reading level. Now, this 4th to 6th grade reading level requires a little bit of a dive, right? Again, please do jump in with questions or thoughts as we are going along. I wanted to give you some background to why we aim for this 4th to 6th grade reading level. It seems a little bit arbitrary. Well, the most important guide is that most US adults can comprehend at this level only, especially when they are stressed. Remember when we looked at the reading statistics and it was 54% read below 6th grade level. It actually, when you dig in deeper, it's something like 36% read below 2nd grade level. It is quite low. And so if you add on top of that, someone hearing information that they didn't expect or wish were differently, you don't want to go above the 4th to 6th grade reading level, right? I have just gathered some of the resources that all point to this 4th to 6th grade reading level as the guide, right? So AHRQ recommends the 4th to 6th grade, and it also points out that some adults will not be able to read them. The CDC has a simply put guide for creating easy to understand materials. And they point out that comprehension levels are often 2 or more grades below the reading or education level. And it drops even more when a person is under stress. So really your goal is to just try to make it as simple as possible, right? Let me point out that throughout the deck that I shared with you, if you see something that is blue like this, it's linking to the resource. So I wanted you to be able to link to these resources so you could find out more evidence yourself. Let's pause here again because I would like your thoughts on this, achieving this 4th to 6th grade reading level. Let me say that whilst this is the guide itself, you will also see in many of the resources that they say that most of the health information is written at 10th grade level. So we are not achieving the guide. Yes, please go ahead. Was it Gary or Paula?
I was going to say, Doctor, when you talk about that path, I know as an elder myself, I have hearing issues, and I know that providers a lot of times they're so critically busy and trying to see all their patients, but more times than none, when I'm in the doctor's office or working with healthcare providers, I think they forget about hearing loss and elders. And even, so definitely if they look at the chart, they look at the age, maybe, some documented hearing loss, definitely can't even get to some of these pieces if they don't look directly at the patient and be more clear, maybe talk a little slower. That really is impacting, because if you can't hear them well, then the stress level's higher, right? And you tend to forget what they're saying. So would that be like under, like when you talked about active, or I think it should come probably at the beginning of that path too, before the messages are, oh, okay, I see that, using clear, simple, and easy. But I know definitely looking at the patient and maybe raising the volume of your voice a little I don't mean
We are,
screaming, but
let me show you, you are getting right there to the visual and body language, which we are getting right
oh,
to.
okay,
But
okay, eye
it,
contact. Okay, great.
exactly. It's one of the things. But to the point you are making around talk slowly, it is one of the guides also, right? It is
Mhm.
using short, simple sentences, talking
Right,
slowly. One of the reasons that I want, well, one, I didn't want the path to be full of 15 things, right? Some
right.
people naturally speak a little bit quickly. And I wanted to show that even if you're speaking quickly and it's your natural inclination, if the words are everyday words, if you are using the words that the patient is familiar with, that they recognize, you're using active voice, you're using short, simple sentences, you are more likely to get to clarity in the patient or the conversation partner understanding. You can talk very slowly, but say things that confound. So that is why it's a very important point to have in there and a good ideal to reach to. But even for people who find themselves speaking quickly, taking some of these elements will allow them to have the language be more plain.
And I think if a provider is using my words, I think I would feel more safe to ask questions if I didn't understand. So good
Yeah,
point, doctor.
right. Thank you. Thank you, Dr. Paula, yourself. Um, Gary, were you raising your hand about to say something in this?
Um, not in this regard of like I mean, I think there's aids that we can use, there's filters that we can use to for getting the right message out through that certain fourth to sixth grade level. I think we've used filters to run our information out before we send it out to the community.
Okay, that's good. And that could be some of these readability tools. I'd be interested to see which of the ones that you use. All right, so let's talk about a fifth step on this path. And remember, this path here has many steps, right? One of the steps that I omitted purposefully from this separately was, for instance, slow down, slow down. But these are some of the key elements I wanted to call out. So number one was using everyday words. Number two is echoing their own words. Three was using the active voice, make clear who's doing what. And four is using these short sentences. We are now on using visuals and body language, right? And thank you so much, Paula, for like really emphasizing this. People understand more what you mean when you show, you use tone, you use nonverbal cues. Eye contact generally makes us feel connected, right? I mean, there are some populations where eye contact it will actually make them feel worse, and then it's something different. But body language, your tone, emphasizing things that need to be emphasized, right? Right. So body language is actually very powerful when you are trying to adapt the language. And then using visuals, we have like a whole letter on this. The P is for pictures and multimodal communications. Using visuals, step-by-step images, that simplifies things also. And you'll notice that I am bringing in some of these principles throughout our trainings, different color schemes, for instance, different images to help you understand where we are moving. This is all part of trying to simplify the message, right? But even as you are simplifying using visuals and body language, there are certain key things that you need to be wary of. You need to be culturally and situationally appropriate. So if you are using illustrations on something around and unhealthy foods, or if actually let's flip it to make it more healthy foods, you should put foods that are going to be recognizable, right? Foods that are going to be recognized, or images in where people can see themselves in it. I won't say too much on this particular one because we will talk about it more in the P for pictures and multimodal communication. And for the final step, it's teach back. We did teach back in some detail. So I've just brought back our flower. Remember when we are talking about teach back, you want to acknowledge that what you are talking about is challenging. This is not their everyday world, right? You want to normalize that you do the teach back and ask questions of everybody so that they don't feel like they're being singled out or you are making any assumptions about their understanding. You want to clarify that the clear communication is a shared responsibility. It's not just their job to understand everything that you have said. You have a job to explain it in a way that they are likely to understand. Right? And breaking the information up into smaller parts, this harkens to using the short sentences, but even for different parts of communication, you need to break it up so that first we are talking about your medication in the morning, your medication in the evening, different from maybe your wound care. Break the information up and then make the questions very specific and focused to them. We've done a lot about this in the teach back session, and also there's a recording of it, but I just wanted to highlight teach back is not about asking questions like, do you understand? That is not going to meet the goal because it's too broad, it's not specific, and people may feel compelled to just say yes because they don't want to offend you, right? So this is the path. Right? These are some steps along the path. There are other things in the path, but thinking about elements that will make your verbal and written language clearer, these are some key aspects of the path. So this was the framework I wanted to share today around the specific skills. Before we get into the tools and the resources that make us, or actually will help us do this, thoughts or questions from others on the call? Okay, let's see, we have a chat. Oh, okay, well, thank you very much, Teresa. Thank you very much. All right, so let's go and move into the tools and resources, right? You will have this as a recording. You will have this file also, so you can access these tools and resources. This is a page that just has an overview of the various tools and resources I wanted to make sure that you were aware of. It sounds like you may already use some. Gary mentioned that there's some filters that you use, but there's 4 categories that I want to talk to you about, and then next week we will practice using. The first is word substitution aids. Now you have this document with you, so you can see that each of these, I don't know if you can see my mouse on the screen, but each of these images are clickable. So you can click into the aid, right? So the first category is word substitution aids. We'll talk about that. The second is these automated readability tests. There are various kinds of scorings and indices, right? Next week when we do the workshop, we'll talk a little bit about like really find your favorite because they do very similar things, and there's no reason why you have to use multiple different tools. So for instance, Word comes with the Flesh scores, so you might as well just use those. And then there are these scoring checklists that come from these organizations that are a little bit more involved. And depending on the type of work that you do, you may not need to go that deep in them. But for instance, if you're routinely writing material that's going out to the community at large, these would be actually very helpful and useful to check to see how how understandable and clear the content is. And then there's curated materials. Sometimes we don't have to do everything from scratch. Medline has a good resource base. There may be others that I'm keen to hear if you've used some other sources that are helpful. So this is the overview. Like if you are thinking, what are the tools and resources? Well, you can use word substitution tools, scoring checklists, and some pre-curated material. I wanted to introduce today some of these resources and talk a little bit about what each does, right? And then next week, we will practice using some of them. So these word lists, essentially, they're there to help you find plain language substitutes for things that you may have to say a lot or often, right? So the University of Michigan has this plain language dictionary. If you do have, and I send the deck ahead of time, if you do have the deck, it's kind of fun. Click into it, see, all of these are clickable, see what is there, see the terms that you use and see if there are some plain language terms for it. But it translates medical terms into more common everyday English words. CDC has an everyday words resource. So there's the more complex version, and then there's simpler terms that is encouraged for you to use in public health settings. And then there's a service called plainlanguage.gov. Oops, sorry. Plainlanguage.gov, and they have difficult terms in general. This one is not specifically healthcare focused, but it was really helpful. And part of the exercise you'll do next week is to see which one of these and maybe others that you have found are your favorites, right? But they have difficult terms, and then they have suggested plain alternatives. And then, of course, the AHRQ within the Health Literacy Universal Precautions Toolkit itself, they have a plain language words appendix, right? Let me ask if there are any other resources, and we can add them here, that you have used for word substitution that would be good for others to know of. We can have this as a resource list, and I can add it to it when I send out the follow-up.
I think the CDC Everyday Words for Public Health Communication is a go-to for me.
Okay, wonderful. So that's here. Okay, let's look at some of the other resources, and then maybe there'll be other ones. Okay. So for the automated readability tests, right? These are there were three big indices that you probably could choose to be your favorites, and I wanted to share a little bit about each, right? So in Word, we have the Flesch-Kincaid grade level readability score. And what that does is it estimates the US school grade level that is needed to understand the text. So a 6.0 means a sixth grader should be able to understand it. It's available in Word. You click the review tab, spelling and grammar, you should see it. For Flesch-Kincaid grade level, you want the score to be between 4 and 6. And I can share from experience, it is not easy to get the score that low. You do have to do quite a good amount of revisions. So this particular score, the Flesch-Kincaid grade level, you want a lower score. Lower is better. That means lower means more people will understand whatever it is that you are communicating. There's also a Flesch reading ease score. That one has a calculation in the background where it's calculating how easy it is to read a text on a scale of 0 to 100. Also available in Word under review and then spelling grammar. We will do demonstrations of this next week, right? There are also some free tools that do these Flesch reading scores. I've put the links here, right? This WebEx. If for some reason you don't have access to Word, you can use these free resources. For the Flesch reading e-score, a higher number is better, right? So this is one of the reasons why I say pick your sort of favorite test and just stick with it. Because if you are used to lower is better for the readability, yeah. Yeah. See Taryn's message in the chat. It's really quite difficult, right? The funny thing is I actually took some of the text from the pre-curated content just to test as I was doing this. And it came out like 9th to 10th grade level. So even when they have tried very hard, it's still quite hard to get it down to the level that you can be sure more people understand it. Okay. So for the reading E score, higher number is better, right? This is why I suggest just pick your favorite score so you only have to think in one direction. There's also another index. It's called SMOG. It's very funny. It's called, SMOG means simple measure of gobbledygook. And it measures how many years of education a person needs to understand the text. That's one to lower is better. Okay. And this one is not in Word. And I think I would just use the one that's more readily available, which is in Word. But for some people to, yes. Yes, I like Flesh Kincaid also, right? So maybe just pick your favorite and we will do this exercise next week during the workshop. So that's for the readability sort of tests. Gary, is the one that you were thinking of, is that mentioned here? Is there another one that we should add? You mentioned that there's a filter of some sort.
No, I think that's the one that I would bump up. The CDC is the one that we were recommended to use. So that's the one that I
Okay.
use.
The CDC.
These are all
Okay.
new, but these are cool.
Yeah, I mean, these ones you put the text in and it tells you what the grade level is. And it's in Word, right? And it's, if you have Word already, it's free. If you don't have Word, there are free versions online. Okay. So that's for the readability test. Now, these scoring tools, I appreciate that these pages are very dense. I want you to keep them as a reference to access each of these resources, right? Which is why I grouped them on the same page. I vacillated between spreading it out, but I think it's just easier when you pick, these are all my readability tests, these are all my plain language things, and then these are all my scoring tools. So when it comes to scoring tools, think of these as manual checklists that help you assess whether your materials are clear or understandable or actionable. And the 3 top ones that at least I was aware of were these ones. So PEMAT comes from AHRQ. And yeah, you really look at your text and you answer the questions. And it's a scoring based, I think you give 1 score or 2, whether you know. We'll do each of these next week as much as we can, but play around with them also. You click on this, you go to the form. It says, do you agree that can people process the information, yes or no? Then you put the score, and at the end you sum up. If your total score is like, I think it's generally 70 or above, then it says that yes, this is actionable and understandable. Otherwise, you need to go back and fix it. So these ones do not necessarily tell you how to fix it, right? Which is the advantage of using the readability. The word will say, change this word to this other word. Sorry, Microsoft Word, that's what I mean. Microsoft Word will give you suggestions on how to improve the text. These scoring tools help you assess whether it is clear, but then you would have to improve it yourself, right? The other tool is the CDC widget, right? Some of these are paper-based. The AHRQ one can be paper-based as well as the SAM. The CDC one is you can answer the questions in a widget on the website. But it's the same idea. It's asking you, is the call to action clear? Is the language direct, free of jargon, things like that. So this CDC Clear Communication Index is another resource you can use. And then there is this one is developed by some health literacy pioneers. It's called SAM, and it's also a checklist, but they have a very specific number of dimensions that they measure along. So again, if you find that your work calls for reviewing or scoring material you've created, I would pick one of these and just become more familiar with it and just use that one, right? Over and over again. So yes, these are scoring tools in one place. So that was the third out of the 4 categories I showed you. Another option is to use pre-created content, right? Medline is a place that has gathered easy to read materials so that it's in one place. There are health topics that are, the starting information is there, and they have been thoughtful about using plain language. So you can even use it as a model for your own material if you are not going to use it as is, right? And the one of the great things is that if they have English and Spanish versions. They do not have any native languages yet, but you can find the topic and then you can click and see how it's been spoken about, how it's been written about. So these are, going back to the summary, just wanted to give you a preview of each of these resources. For our workshop next week, and let me just test. Okay, good. You're just right on time. For our workshop next week, we will use these tools, and we'll try to get through as many as we can, just so you are familiar. And then I would say pick your favorite and then use that over and over again. But these tools are there, right? So we are now pretty much at the end of the time. I want to go over these takeaways, right? Adapting language to make it clear and accessible is not a nice to have, it's essential, especially important in the communities that we serve. The other, I think, more hopeful thing is that even when there's lack of resources like translation services, there's a predictable path. There are some elements that you can follow that improves and makes your language more plain so that more people can understand it. This is using these common words, echoing what the other person is saying, using active voices, non-verbal cues, and teach back, amongst others, right? And the word lists, substitution lists are very helpful. Like everything, it's a muscle that has to be trained, right? For instance, I love to use the word trivial a lot. I always try to remember to use the word easy in its place, but there are more than likely some words that you are using where there are simpler forms that you could use also. So look at these word lists and build a toolkit of easier words that you can slip in for the more complex ones that you use. And even more helpful are these automatic tools and these manual checklists that help you improve what you are writing. Remember, both in verbal and written communication, the goal is to be at that 4th to 6th grade level. Some of these readability scores are very easy to use in Word, Microsoft Word, and we'll do that next week. Some of the scoring tools are a little bit more involved, the PEMAT, the SAM, and the CDC Index. It's really training you to assess, right? But then you need to go back and fix it. So that is it for our training portion. I really hope I will see a lot of you for the workshop. That's where the fun is, right? You can take the links that I've shared and start to play around with it. And I will share the deck for the workshop. I try to do it the Tuesday before the Thursday, so it's not too soon or too close to the time, so that you can see what we are going to do for a workshop. Please do take a moment to fill out this evaluation, and let me just also put the link in the chat. Okay. I would appreciate thoughts, questions, comments here. I'm putting the evaluation link in our chat.
Again, BB, all these are very helpful and great that it's all put together for us so we can put it on our computers and just quickly access them. So really appreciate the resources and going over everything again. It's very helpful.
Thank you. Thank you so much. I tell you guys that the work you do is so important. You probably live in it all the time, but it's really inspirational to be able to work with you. So if this is helping your work, I'm very happy to hear that. Okay. All right. So we just have about 2 minutes. Thank you, Taryn. We have about 2 minutes and the evaluation is very short, but I wanted to leave some time for you to answer it. And if you think of any other resources, please share with me so that we may incorporate it in the list. It's handy to have everything in one place. Okay.
I appreciate how efficient you are with your time, BB. It's like this is really condensed stuff, but I mean that gives us more time to explore what we need to do. So we do have homework, which is cool too.
Yes, and thank you, Gary, for being always at these sessions and in the workshop also. So I'll send out the videos. Hopefully those who are not able to join live will get some of the base so that we can dig in during the workshop next week. Okay. All right. Thank you all. I will close the meeting right now and see you, hopefully many of you, next week.